Hi, good morning and good day from wherever you're joining this live session. We are going to be discussing about brain awareness because this is Brain Awareness Month and Alzheimer's in particular. So I'm going to start with a couple of topics that I have in mind to discuss about Alzheimer's. To start with, first I'd like you to take you through what really Alzheimer is. So you would have seen some old people having memory disturbances and having some important mental functions getting deteriorated. So Alzheimer is one of those diseases which has a progressive disease which destroys someone's memory primarily, and then a lot of their mental functions, their ability to recollect things, their ability to know who they are, their ability so apart from the basic life functions that a mind does, a person usually tends to forget. And you can say that this happens because the brain cell connections, like two neurons getting connected to each other, they end up getting degenerated and they die. So eventually, majority of the mental functions of a patient who is suffering from Alzheimer's result in a very deteriorated short-term and a long-term memory. And along with memory loss, confusion is also a very big parameter because any short term goal that they had or they had completed or done appears to be really lost. There have been advancements in and around the areas of Alzheimer's. We have seen more and more people get diagnosed and get better, but there has never really been a definitive cure for the same. Medications, medical managements, and some sort of surgeries can be done, have been done, in which we have seen that they might improve some symptoms or some problems that the patients face temporarily. So, moving over to the point number 2 that I have in mind, that what are the signs and symptoms of Alzheimer's? If someone in your family or your friends or anyone that you really know of is suffering from Alzheimer's, what are the kind of symptoms that you'll see? What are the complaints that they might come up and try to discuss with you? So as a counseling mechanism to try and understand what all actually needs to be looked at, I have tried to jot down a couple of symptoms or maybe are in the initial stage. They have a lot of general discontent. They feel generally lonely, and all of this ends up adding to a lot of anger. And psychologically, they get depressed, and behaviorally, there is agitation, difficulty to understand what they really want. Self-care is a big problem for them because of the other psychological issues that are going along with them. And we also see them murmuring meaningless repetition of words, which is another very decent parameter which can be clubbed into behavioral, mood, and psychological understanding. Other cognitive functions. So when I say cognitive would mean what happens to the brain and how does the brain represent this out to the humans. So what happens in the cognitive function is that we see a very nice mental decline. They are not able to think and understand in evening usually, because in the morning the stress levels are less. So once that their stress levels rise, which would be evening hours, we see delusion in them, disorientation. They usually tend to forget things and then end up making things, because obviously that is how the human mind works. And the ability to do simple math, the ability to have daily monetary interactions with people are all of these things that we usually see that an Alzheimer patient, one such patient is forgetting. Now there are a lot of common tests that can be done, and the correct department, the correct specialty, super specialty that you need to visit to get someone diagnosed with an Alzheimer is neurology. Neurology would like to study the brain of the patient, do an EEG and an MRI of the brain to try and understand and obviously correlate it with the physical symptoms that the patients present. So a single diagnostic test might not be a very baseline to try and determine if a person has Alzheimer's. The doctors usually advise to have the patient sit with them, have a little bit of a session with them, try to understand a couple of parameters, and based on those, they are able to try and understand. Now, obviously, we've discussed about what Alzheimer is, what signs and symptoms to actually look out for, and how is it diagnosed. Now, trying to understand what are the treatment options available. Now broadly, I have tried to distribute the treatment options into 3 sections. First being medications. Second would be uh, let's call it exercises. Let's call it physical exercises, stimulation, neuromuscular rehabilitation, as you may. And third would be surgery, in which the percentage of people taking surgery or the percentage of hospitals doing the surgery is rather less, because uh, it is still an ongoing trial phase for these things. So to discuss, if I go into the pharmacological aspects of this, we as doctors usually try to give cholinesterase inhibitors, which are supposed to have the both nerve endings to actually conduct the electrical impulses. So ideally it is happening that two neurons are not able to share their appropriate amount of electrical impulses between them. We, through pharmacological measures, through medicines, through salts, are able to increase this, and we see temporary relief in patients. Some most commonly used medicines for this by their generic name are donepezil, galantamine, and this is rivastigmine. So these are the inhibitors that the hospitals and the doctors usually advise for on a regular basis for the patients. Secondly would be the neuromuscular rehabilitation. So basically in such cases where a patient is suffering from Alzheimer, there are a lot of aerobic exercises and mental exercises and physical exercises that over the years more and more physiotherapists and neurologists and neuromuscular rehabilitation specialists have sat together and made a lot of scholarly articles on those. So ideally what has been told is that a very fulfilled body will have a very fulfilled mind, and all these physical fitness and aerobic exercises, they tend to have a very positive effect on your brain. And because of these various reasons, we see that uh, people having more developed muscles and more developed growth also helps the cardiovascular system, which will then come back to the brain and have a little bit of more electrical impulses. So these could be called as self-healing or physical exercises. And so these would be the three kind of treatment discussions that I wanted to do. Now our offerings at as MediGence for the same would be our Tele Rehab product. We have very recently introduced a very nice used case for such non-surgical, and I would say more of the counseling cases. So Tele Rehab, we have our experts in neuromuscular rehabilitation, and at the ease of your home, you will be able to connect with the finest physiotherapists out here who can help you understand what your condition is, and then what all methods and mechanisms can you actually do to try and understand and get better. So majorly what people with Alzheimer's face is dementia, memory loss, and it has been told that physical rehabilitation and physical activity and more aerobic exercises has a very modifiable reducing risk factor to dementia. So for the same we have our offerings here. We have a global presence. We can get you reviews from neurologists all around the world, and you can help get to choose the best country and the hospital. Surgical, non-surgical, self-healing, counseling, whatever means to be, we are there to support along the way for your patient's fitness, for your patient's great recovery. So we as a team at MediGence always try to maintain a global presence and always try to make the global healthcare pretty accessible. So for anyone around the world wanting to go anywhere in the world, we were there to support you. And lastly, I would like to try and give you a little brief about our post-operative rehabilitation packages, which is very similar to our tele rehabilitation packages. And in such cases where surgery is not really an option in majority cases. So to talk about surgical option offerings for Alzheimer's could be that some doctors have done and tried to do some deep brain stimulation implants. which have improved to certain percentage, but there has still not been a very conclusive evidence of a lot of patients deriving better things out of it. Hence, majorly medications and non-surgical or maybe just minorly invasive procedures are advised or done. So, lastly, I would just like to try and discuss about our post-operative rehabilitation packages, which obviously, for example, if your patient has visited the hospital and you've been advised for medications and you took a physical therapy session there, once that you reach your country, once that you reach back your home, we are more than happy to provide you tele rehab sessions, tele post operative rehab consultations packages, in which you can get I would say priority appointments with your choice of dietitians, your choice of neurologist, your choice of physiotherapists, so that you can have a virtual clinic around you, so that you don't really have to travel over and over again for the same thing, unless and until it is indicated by the physician in charge. So these were a couple of things. If anyone who is in the live session right now would like to possibly ask me something, I would be more than happy to try and answer your doubts, please. All right, then I think I'm going to wrap this up. We would try to do a little bit of more sessions like this in the future. Our team is working on a good series of content that we would like for you guys to see and have a little bit of more content creation around all this. Yes, so Megha has asked a question that what the additional benefits one can get with MediGence. So basically, you will be able to have a global. We have a global presence. I think the prime value addition that we as a company give is that, first of all, we are very customer centric. We if we are advocating something for you guys, then we are in your team, and our post-operative rehabilitation packages, our clubbed offerings that we offer are of very good assistance. And I think we are in total trying to make healthcare accessible. We just don't want that kilometers or overseas treatment should have a problem if people don't. So I see that lack of information and lack of accessibility has caused a lot of people to lose out on the important ones in life. And we as a team always try to. We've been trying. I would say that it's a journey, and the journey is still going. So we are here to try and make it more accessible, so that no one should lose out on things only because they didn't know. So I think that's where MediGence comes in. You are all yeah. So I think if there is anyone who would like to. Okay, author EMP Kaylee, thank you for calling it a great job. Says thank you for your feedback. And okay, I think we will wrap it up, and I'm going to see you soon with a lot more of these live sessions, in trying to have a more interactive audience session in which we can chat and try and discuss how the world of medicine is changing, and and the latest advancements. All right, guys. Thank you.